Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, the FDA authorizes COVID vaccinations for young children. And My Healthy Maryland is launched to improve patient care through precision medicine. But first, the New England Journal of Medicine has published findings from the world's first pig heart transplant at the University of Maryland. In the publication, the transplant team detailed the historic Xenotransplant and provided critical data for surgeons and scientists around the world. Maryland resident David Bennett lived for 2 months after receiving the pig heart. The paper addressed a complex array of factors that ultimately led to heart failure, including a stiffening of the heart muscle, his condition prior to transplant, and medication issues.
Everybody that we've presented to, and I hope the public will agree, and those that read this article, that this was, in essence, wildly successful. A 60-day survival in a patient as sick as Dave was really was quite remarkable. Had we done a human heart transplant, I'm not sure David would have done any better.
Doctors reported that the transplanted pig heart showed none of the typical signs of rejection, even when carefully examined during an autopsy. But the doctors did discover traces of DNA from a pig virus.
There is no evidence of this virus infecting Mr. Bennett. The DNA of the virus that was detected from the heart should not have been there. So we are developing very sensitive methods to make sure that the donor pigs don't have this virus.
The publication provides vital information that will help surgeons and scientists to advance the field of xenotransplantation. Young children are finally starting to receive the COVID vaccine following authorization by the FDA. The Moderna vaccine can be given to children under 6 and the Pfizer vaccine to children under 5. The American Academy of Pediatrics recommends that all children over 6 months of age receive the vaccine.
COVID can be a serious disease for children. I think many people have been, under the belief that it's a very mild disease, and that is true for the majority of children who get COVID-19, but not for some. It's currently the 4th or 5th leading all cause of death in children.
During the Omicron surge this winter, young children were hospitalized at a higher rate than older children. University of Maryland Medicine has launched a landmark initiative called My Healthy Maryland Precision Medicine Research. My Healthy Maryland will help researchers understand how genes and lifestyle affect a person's health.
It will recruit up to 250,000 Marylanders from all over the state, representing the full diversity of our communities. And we hope to engage these 250,000 individuals in research over a very broad range that ultimately will result in improved health for Marylanders.
Participants will be asked to complete surveys about their health, family history, and lifestyle. They will also be sent a home kit to collect and return a saliva sample to obtain their DNA for the study. The DNA samples will be stored in the UMM biorepository and available to all qualified researchers. The study will also make use of electronic medical records.
What that allows you to do is to make correlations on a large scale between genetic data and health information about people. And that allows you, one, to make discoveries. It also allows you ultimately, once you make those discoveries, some of which have already been made, to treat and prevent disease.
A particular focus will be on underserved populations who experience health disparities, more illness, and shorter lifespans.
We know that one size doesn't fit all. Different diseases are different in different populations. In addition, different people respond differently to various medications. So we really need to understand disease and health across the entire diversity spectrum.
Any Maryland resident over the age of 18 can register online through the My Healthy Maryland website or smartphone app. In the future, researchers hope to provide study participants with information about genetic variations that may warrant follow-up evaluation. Reducing the negative effects of trauma on children was the focus of the Baltimore Trauma Summit, hosted by the Center for Epigenetic Research in Child Health and Brain Development. City leaders and scientists from the School of Medicine at other universities around the country participated in the two-day event, which focused on reducing crime and violence, improving education, and access to resources.
It's the compounding effects that really alter how the brain develops for children, how we interact as a society, and our risks for everything from mental health disorders to addiction, increased rates of incarceration, how we interact in our communities. COVID has very much amplified these effects.
Are we actually looking at our young people who have experienced the most trauma as worthy of healing? Or are we sending them the signal that we need to correct you and control you?
We are the medicine. No matter where you live, no matter what city or town you're coming from, we have the collective capacity to help ourselves and others heal from trauma.
The summit also highlighted the efforts of community workers and activists working to help reduce the impact of trauma on children. And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again next time.